We're focusing on your family and the health of your family, especially when it comes to children. Even though the pandemic has become part of the fabric of our everyday lives, what it has done and continues to do to kids could prove problematic. Tracy Perryman of the Center of Hope Family Services wants to help. Good morning, Tracy. Thanks for joining us this morning.
Good morning, and thank you for having me.
Absolutely. Such an important topic. Why is it so important that we're talking about mental health right now, especially with children?
Yes, for one thing, children are one of our most vulnerable resources, but one of our most valuable resources. So in any situation, I'm always advocating for attention to children. But specific to COVID and mental health, we are noticing that hospitalization for mental health symptoms among children aged 5 to 11 are up almost 25% since the beginning of the pandemic.
Wow, that's significant. Yeah, I mean, what is the pandemic's impact here on kids? I mean, they've had to deal with a lot of changes, haven't they?
Yes, absolutely. And sometimes we forget that children have reactions to stress just like we do. Children are impacted by bereavement just like us. Children are impacted by social isolation just like us. And in many cases, they've been separated from the systems like schools and other social services that are there to intervene. And so the research has shown that over 25% of high school students are reporting worsening emotional and cognitive health. And 20% of parents with children ages 5 to 12 have reported similar worsening conditions in their children. So that's of note. And also in Lucas County, we're seeing that 38% of our youth are reporting that they feel so sad and so hopeless almost every day for 2 weeks or more in a row. And they felt that sad to the degree that they stopped doing some usual activities. And for female children and youth, those rates have been 47%.
Wow, so 38% of Lucas County youth, 47% females. It's so troubling, and I can understand it. I mean, I believe it. With everything that everyone has been through this past year and a half, these kids, they just need that sense of normalcy, and it's just sad. It makes you sad. So we were showing it on the screen here a moment ago, you know, some symptoms, some signs to check out for. What should we be looking for in our kids?
So I can't emphasize enough the importance of being vigilant with our children, because oftentimes they are not at the maturity level where they can express the emotions that they're feeling. And even if they have the maturity and have the language and the skills for it, a lot of times they don't want to worry their parents. They can be afraid to express how they're truly feeling. So we have to be watchful. And so some of the things that you can look out for are children who feel guilty or useless, children who don't pay attention when others are focused, children who are more irritable than usual, children who pass on fun activities that normally they would love to do, changes in behavior like eating more or eating less, sleeping more or sleeping less, or feelings of fatigue or tension, and then also signs of self-injury, looking for cutting or scraping or other types of self-destructive behaviors.
You know, so now that we know what to look for and what to keep in mind in the statistics, what can we as parents do to help our kids?
So again, just being mindful that if we are feeling tense or stressed, that they're probably feeling the same way too, but they don't necessarily have the resources that we have to cope. So as we're going through things, taking that extra step to look and see how they're doing, how they're responding, to check in. And when you ask questions, give reassuring energy, making sure that we're not going through those drilled questions. Did you get your homework done? Did you get your clothes off for the next day? Did you eat your dinner? But asking them, how are you feeling? What's going on? When you see changes, saying, I'm noticing that you're changing in this area, or this behavior is different. Do you want to tell me why? Also, if you see things like grades slipping, sometimes as parents and adults, we want to say, well, you're not doing this, or you need to work on your time management. But taking the time to ask a child, what can I do to help? Those sorts of things definitely open the door to dialogue. And if you find that the child does not have the words to express what's going on with them, or you don't know how to ask the right questions, which most of us don't, because even if we know how to ask certain mental health related questions, we have to make sure they're developmentally and age appropriate.
Sure.
Those are the opportunities to reach out for help.
Yeah, and you can reach out to your folks there at Center for Hope. Text the number 4, so 4HOPE, to 741-741 and get hooked up with some really great resources. Tracy, thank you so much for joining us this morning. It really is important. We appreciate it.
Thank you, Amanda.
Yep, take care. Well.